firsthand from Novant and not have anything filtered through today's media or other channels. You can go right to the source. So with that, I'm going to ask Natalie to introduce our guest speakers for today. Natalie?
Thank you, Michelle. And I add my thanks to everyone for joining us this morning, and also my appreciation to both the hospital systems and UNC Health, as well as the medical school at UNC, and all the PAG members, just for all of the work. We have several PAG members joining us today. I've seen Spence Broadhurst. I've seen Meade Van Pelt. I'm not sure who else might be on the call, but thank you all, and thank you for joining us today. And also to Representative Holly Grange for joining us today. Thank you for your service. So I'll start out by introducing a longtime friend of mine, Frank Emory. Frank is Executive Vice President and Chief Administrative Officer for Novant Health. Frank and I've known each other for, I can't remember how long. We have some funny stories to share, but we can't do that in public. And so we'll save those for a drink at a bar sometime in Wilmington in the near future, hopefully. But Frank oversees the legal, government relations, risk management, corporate audit, compliance, human resources, diversity and inclusion, and health equity team. So he's got a big portfolio. Prior to joining Novant in 2019, he was a partner with the international law firm Hunton Andrews Kurth LLP, where he was co-head of the litigation and labor group and managing partner of the Charlotte office. He's been a corporate lawyer for many years. He attended Duke University as an Andrew B. Duke Scholar, and then UNC Chapel Hill School of Law on a Moorhead Law Fellowship. He is the chair right now of the Economic Development Partnership of North Carolina. He has served on the Board of Transportation. He has chaired the Charlotte Chamber of Commerce Board. He's a member of the Duke University Board of Trustees, and he's the first African American and the youngest chairman of the Charlotte Mecklenburg Planning Commission. So he has a breadth of experience and knowledge, and he's so wise. He's a counsel of mine and has been for years. And Frank, I thank you for joining us this morning. And not so long, but still a good friend of mine, I'd like to introduce also Shelburne Stevens. He has served as the president of Novant Health Brunswick Medical Center since 2012, began his career in Novant Health in 1990, and then joined the Brunswick Center in 2006 as Senior Director of Operations. During his tenure, he has worked in a wide variety of departments and held a number of leadership roles. He was instrumental in the building of and move from Brunswick Community Hospital to the state-of-the-art expanded replacement facility, Novant Health Brunswick Medical Center, which happened in 2011. Prior to joining the Brunswick facility in 2006, he was Director of Cardiopulmonary Services for Forsyth Medical Center in Winston-Salem. He received his bachelor's degree in Business Administration from High Point University, and completed his master's degree in business administration at Gardner-Webb University in Boiling Springs. He serves on the board of the Novant Health Foundation Brunswick Medical Center, the Brunswick Community College Foundation, Lower Cape Fear Life Care Board, and the Brunswick County Economic Development Commission Foundation. He was awarded the 2012 Brunswick County Citizen of the Year Award from the Brunswick County Chamber of Commerce. And just last year, along with 99 other business leaders in our community, was named one of the 100 by the Greater Wilmington Business Journal. So Shelburne, thank you so much for all that you do for our regional economy, and welcome. We'll turn it over now to Frank and Shelburne, and I think we're going to share a screen so that you all can see their presentation.
Yeah, thank you. Thank you so much, Natalie, for that generous introduction. I'm really glad to be here with you today. Look forward to your system incident commander, which means I'm the person who's supposed to, we have hurricanes or whatever that's going on. I'm the person that says yes, no, go left, go right. And I figured out pretty quickly that Shelburne is the guy that says, I got it. And when he says, I got it, I got it. So if there's a hurricane coming, he's telling me everybody's good, I turn to the next hospital because I know he's all right. So I'm glad to have him here today. The other person from our team is Courtney Lizette, who serves as chief of staff to my part of the business. And she lost a straw poll and works directly for me. And so so far, she's showed up every day. So I really appreciate that. And thank her for being here. She's going to run our presentation. What I want to do today is talk a bit about, give you an overview of how we see the proposed partnership, and then very much interested in a conversation with you all. I'd be remiss if I didn't mention Spence Broadhurst, who serves out together with me on the board of the Economic Development Partnership of North Carolina. And I mentioned that because for a couple of reasons, I've gotten to know him through that, but also because I think a key feature of what we're talking about is an economic development boom to southeastern North Carolina, and indeed a good half of our state. And we'll go into that more. So thank you. I appreciate all of you being here this morning. So with that, Courtney, will you start the presentation? All right, you move on to the slide 3. All right, I start here with this slide because I want you to know that at Novant Health, most everything that we do revolves around our mission, which is to improve the health of communities one person at a time. And whatever initiative we have, whatever focus we have, whatever problem we're dealing with comes back to, does this advance or deter from that mission? We believe that this partnership advances that mission, and so we're very excited about this possibility. Next. Wanted to see, this is the executive team. Carl Armato, who's a number of you have either met in person or seen. He's our CEO, and the balance of the folks on this slide are the people, each of whom report to him, and all of us have a piece of the business to ensure that it goes forward. I wanted you to see both that with one exception, me. They are highly skilled, hardworking folks, and I am very very pleased and honored to be a part of this group. Next. You know, as we think about patient care, which is how we're judged every day, I wanted you to see this slide simply to make the point that at Novant Health, our standard is remarkable. And we define that in these 6 bullets, but every patient in every dimension and every encounter, not only do we strive for that, but we go back and check and we ask patients through surveys, text messages and other things, how did we do so that we can improve? Because ultimately the test and the measure of how good a system we are comes down to what the experience is of each of our patients and each of the people who encounter us. Next. I wanted you to see this slide so that you can understand a bit about our current geographic dispersion. This is illustrative and not demonstrative, but you know, so you can see that most of the orange dots in particular represent our ambulatory strategy. We have more than 600 ambulatory sites in our system, the majority of which are in I'll call it the middle of North Carolina. You can see where they are. And then you can see Brunswick down in southeast North Carolina. We have some sites in South Carolina. I said southeast PA in Northern Virginia, so that gives you a sense of what our footprint is. Next. This slide's important to me for a couple of reasons. One is Leapfrog, as you may know, is an independent group that rates hospitals on safety and quality, and you know those are the watchwords of medical care, right? I mean, it's got to be safe and of high quality, and they assign letter grades to hospitals. You may know this, but I like saying it. There are only 5 grade A hospitals in North Carolina. 4 of them are owned by Novant Health, and 1 of them is owned by UNC, our partner in this enterprise coming down. 1 of those 4 A hospitals is Shelbourne's hospital, Brunswick. Next. Here, I think is a good illustration of our operating strategy. We've talked some about how people ask us a lot about, well, how will, you know, if we are able to complete this transaction, how will New Hanover fit in the system? Well, what I want you to know is that we are accustomed to, in fact, we were early adopter of what we call a hub system. So each of these, Winston-Salem, Charlotte, Eastern North Carolina, Northern Virginia, each of them is a hub. Each of them has a local fiduciary board, and each of those boards has representation on the parent board. And each of them is an operating unit, you know, that helps make our system go. And so if we're able to complete this transaction, then we'll all have to come up with a good name, but you know, whether we call it the New Hanover part or the southeastern North Carolina part, or whatever the fancy name it will be on this slide as an additional hub. here, a major operating unit of the Novant Health system. Next. One of the things that we have found is not only helpful for us, but we think really aids the provision of good health care, is to be very much involved in the communities we serve. So this slide gives you some examples of things we have done and are doing to get out in the community. We're trying to get away from great come to us. We try to extend ourselves to where people are. So I'll point to the middle of the slide. You see the Winston-Salem State Community Care Cruiser. That is something that was needed to serve communities around Winston-Salem State. You know, they have a very successful nursing program. And so we created that so that we could take that primary care site around to where it was needed. You see a mobile mammography unit there to the top right of the slide. We partnered with a company called Movement Mortgage. It's owned by Casey Crawford, who used to be a Panther, and we created a medical office in an underserved area of Charlotte. And then Michael Jordan, we've built one and anticipate more, again, primary care clinics to be spread around the community. Next. Here, I just want you to know that, you know, some people have asked on a number of occasions, well, you know, what's in this for you? Why have you all, you know, offered this, you know, the price that you did? You know, how do you make money? And what I decided this slide would be is the answer, the simplest way to answer that question. We're not a privately held, publicly traded company. What we are is we're a community organization. And so, as you can see here, in the last full year, we provided almost $1 billion of community benefit in the areas that we serve. That is how we measure our success as a system. And there are a couple of examples, or 4 actually, we put up here. But I'll just mention, you know, closing. You know, we look at closing health disparity gaps, diabetes prevention, and I'll mention that. And some of you have heard this in other presentations. But you know, our commitment to charity care is that if a person in your area and in all of our system, but in your area, I think that 300% of the federal poverty level is $78,000. If you in a family of 4, you earn $78,000 or less, you will never get a bill from Novant Health for medical care. Next. One of the things that I know is important to the leaders in the business community of New Hanover and surrounding counties is health equity, and in particular behavioral health services. We want you to know that, you know, we focus on that, and in particular the opioid crisis, and working to ensure that we can ameliorate the devastation that has created in a lot of our neighborhoods. So that's front and center. It is something that is in our company's specific operating goals to manage that down. And so I wanted you to see here that this is something that's part of our current operating panel, and we expect that will continue in working with you. Next. You can go to the next one. I think, well, health equity is something that I know is spoken about a good bit. I know that New Hanover Regional has a key focus here with specific people whose job it is to deal with this on a day-to-day basis. We define health equity. I like this quote here: "We're all in the same storm, we're just not in the same boat." And this slide, I think, it gives a nice reflection of what equity does. Equity versus equality. In the top of that slide, you see everybody has a bicycle. Everybody has the same bicycle. But then you look at the bottom slide, you see what we do. Everybody now has a bicycle that fits them. And so what our work is to do is to try to personalize care so that we don't treat everybody as a widget, but we try to think about what are the gaps, what are the things that folks need to get them and keep them healthy. Next. And so when I talk about achieving health equity here, we received the inaugural CMS Health Equity Award in 2018. We've signed the Equity Pledge. We're a top performer in diversity excellence. And in particular at the bottom, I want to talk about, you know, because not only is health equity important, but also we try to work to increase, augment the economic prowess and strength of areas where we are. And so we look for supply diversity excellence. We spent $1 billion since 2010, I believe it is, with respect to our diverse providers, diverse suppliers. And we want to up that goal, and we would plan to introduce that program into the southeastern North Carolina as well. Because what does that do, right? We help build businesses, which means we help create wealth in the community, which means we help by creating wealth, I think we help to improve the health care outcomes and access to health. So it's a virtuous circle by doing this and handling it in that way. Next. I wanted to mention here, just to drive home the point about health equity. One, and I'll just use one example. We look at the gaps in outcomes. Our chief diversity officer is one named Tanya Blackman, and she tells us very well. But we noticed that there was a gap, a dispersion between the readmission rates of Blacks and whites who had the original diagnosis and hospitalization due to pneumonia. And so what we do when we see a gap like that, we look to try to figure out what's going on, what is that gap, we try to close that gap. Well, the way we did it in this situation with the pneumonia readmissions, where we went out to and figured out that there was a need for more post-discharge education to help people know how to take better care of themselves so they wouldn't come back in. Well, when we started doing that education, we did it for everybody. The result was not only did we close the gap, but the readmission rate for Blacks and whites went down. And so I say all that to make this ultimate point. Health equity helps everybody, even those who are doing well today. It helps everybody do better, because when we close gaps, we see opportunities to make our care better and to ensure that people's access and, frankly, the quality that we provide improves. Next. We employ a physician leadership model. If you remember the model of the executive team, we have a chief medical officer. One of our executive team members is the woman. She's both of them are physicians, and the woman who runs the employed physician network. There are about 2,600 caregivers in that network, all who are employed by Novant Health. And Dr. Oliver sits on the executive committee as a result of that. So I want you to know that the physicians, their needs and, frankly, their ability to grow are, as we say here, a cornerstone of what we do. Next. So in this vision, I'll just say here and point out, I don't know that it would have been any closer if we had all planned it. We use almost the same words to describe our mission. NHRMC aspires to lead community to outstanding health. We talk about improving the health of our communities. Our visions and our values are very much aligned. And so, culture, in those of you who, I know this is a business group, so I can say this without fear of contradiction, in any sort of business transaction, any combination, culture is critical. And here our cultures, deep, long-standing, are very much aligned and extraordinarily similar. So we see this as an asset, the two cultures, rather than anything that we might have to climb. Next. You see here our, just point out the check boxes, and I don't mean that to diminish them, but simply to talk about the things that we all care about. And I have here governance down at the end, because I know that one of the things that people are understandably interested in is how the governance would work. And I'm happy to talk about that more as we get into our question and answer. But if you would remember the slide I had with the hubs, just, it would be exactly the same as our other hubs, at the local leadership, the local fiduciary governance will remain the same. They will have the same obligations. They will have representation on the parent board as we work together as a system. It has worked well in other arenas, and we would expect no different here. Next. All right. So here, Shelburne, I've been doing this. This is your area. Do you want to talk a bit about how you all have grown Brunswick?
Sure. Good morning, everyone. Thanks for having us. If you've been in the region, for the last 14 years, you've been able to witness the growth and how we've changed healthcare for Brunswick County. In 2006, when we came into the market, healthcare in Brunswick County was just the opposite of what New Hanover provides today. It had a bad reputation. Most people did not stay local for healthcare, but that's what we heard that they wanted. So quickly after we got here in 2006, we saw the need to expand services and grow. And we thought about building onto the old community hospital, but that was just not possible. So that's when the decision was made to file the certificate of need to build the replacement hospital. Courtney, if you'll go to the next slide. Here's sort of a history of what was Brunswick Community Hospital, is now Novant Health Brunswick Medical Center. And I can say we built a new hospital, and I've moved from my old hospital to a new one. It was a tough task, but it was a great team to do it. The next slide will just show you some of the services that we've added over the years. And I will just say that New Hanover Regional has been a great partner for years for my community hospital. I have never seen us as competitors. A lot of people use that word with us. We built a great and excellent community hospital, and New Hanover is a great and excellent tertiary hospital, and that's where the majority of my referrals go. And when I hear John Gisdick talk about all the patients waiting in his ED4 room, a lot of times it's patients that came from us because we may not have that specialist in Brunswick County, and we need to send them up the road. So part of this potential partnership that excites me is how can we continue to collaborate to keep some healthcare locally and not have so many people waiting on beds up in Wilmington, but grow services for the region. And you can see on this list a lot of the services that we've added here, one of which has been cardiac services. We partnered with New Hanover years ago for their cardiologists to cover Brunswick County, and they have medical office space next door. We've been able to add mobile cardiac cath, several things around that to continue to provide services here locally. A couple years ago, we made the joint decision to put one of their helicopters here in our critical care transport. And there's been numerous stories of patients having a cardiac event or a stroke that they never came to my hospital. They came on site, got on the helicopter. We had them at New Hanover in record time, and they had intervention and no deficits moving forward. So the stories, every time I hear them in the community, it just warms my heart to know that we're providing that excellent care for this entire region already. Courtney, if you'll go ahead. This slide just sort of gives you a picture of the growth that we've had from employees to employed physicians and the medical staff and volunteers. And we could not have done that without being part of a large healthcare system and having those resources. And as Frank mentioned earlier about hurricanes, I have him on speed dial for what supplies I need and stuff, but we do know how to weather those storms. And I've said it many times this year, I'd take a hurricane before I'd take COVID. For sure. But really, I get excited every day thinking about the potential partnership, and all of us coming to the table to talk about what services are there, what gaps are there in healthcare, how do we meet those gaps, not only in New Hanover County, Brunswick County, and the surrounding areas, and just excitement of getting out into the community and hearing the community members and their needs, listening to business leaders such as you all yourself, how we can help meet your healthcare needs. Brunswick County doesn't have as much industry as New Hanover County, but we've partnered with ATMC and Brunswick Electric. We have a clinic on site at ATMC today for their employees. They're self-insured, and it's been a great service for them. So we've been very strategic of how we partner to help support local business and help them grow as well. And I look forward to doing that in the future with John and his team and all of you as business leaders across the river. So Frank, I'll turn it back over to you.
Thanks, Shelburne. And so thank you all for allowing us to give you an overview of how we're thinking about it. I look forward to your questions. Natalie, let us know how you want to proceed.
All right, well, hopefully I've successfully gotten myself off of mute, and we can. So Frank, first of all, thank you very, very much for kicking things off in the presentation, going through the overview of Novant Health. hearing that information for me helped put everything into much better context. And then Shelburne, hearing directly from somebody who is running a current Novant healthcare system was also very impactful. And so what I'm going to do is I'm going to kick off the first question to give people a chance to be able to think through what they want to ask. As a reminder, you should have a feature on your system somewhere to be able to kind of raise your hand. If you don't see that, then just maybe you could go there. So my first question is actually for Shelburne. And early on in today's presentation, I mentioned we've been on a 9-month journey. As I thought about it, it was actually the PAG that's been working on this for about 9 months. It was a year ago when we first announced that we were exploring the future of healthcare for Wilmington. And I can remember being in a community open meeting and there being immense emotion at the time as people had first heard about this possibility. And one of the things that I heard over and over again was this concern that people had where they felt that our current hospital system, being a community-owned system, they had much more personalized care, much more genuine care. They were really worried that we were going to partner or sell to somebody and they would just become a number and people wouldn't really care about them as an individual and their individual personal health. I think Frank's presentation did a great job talking about the culture and how much the focus is on people and on quality healthcare and on excellence. But I'd love to hear from you. What have you seen and what would you say to those people if they were on the call today to help relieve their fear that they might just become a number?
Really, we spend a lot of time looking at data. And you're right, New Hanover is great. They treat their employees great. I feel like we do a great job all across Novant Health. And personally here at Brunswick, we've always had great engagement from our team members and our patients. But we spend a lot of time looking at patient surveys, employee surveys, and dissecting that data, not just that they're nurses or respiratory therapists or rad techs, but we also look at the age and our patients. We look at their demographics, where do they come from, what is their ethnicity. So again, how do we meet all of that? So that's where our diversity and inclusion office comes in to help us, not only in the treatment, as Frank pointed out, around pneumonia care, but we use it, how we're meeting the needs of the communities that we serve. So I think this partnership just enhances that to where we can share more stories locally. I think we're going to learn from New Hanover as a system. There's going to be things that they're doing better than the rest of the Novant Health hospitals. And then there's going to be some things that we can bring to the table to help them enhance the experience for patients and for their team members. And again, I look forward to hopefully one day sitting down and putting our 2 strategies together for Brunswick and New Hanover County and really having genuine dialogue of how do we get those services out to the communities. Healthcare has evolved. It's not all about hospitals today. While that's important, a lot of the ambulatory outpatient setting has become a key driver, and that's how we lower cost as well as in those ambulatory settings. So really sitting down and strategizing over that is how we'll move forward. So I hope that answered your question, Michelle.
You did. Thank you very much, Shelburne. Megan or Natalie, can you help me know who has the next question?
Yes, Representative Holly Grange has a question.
Good morning, and thanks to both of you for the wonderful presentation. I just want to tag along a little bit with what Michelle asked and talk about one of the things that New Hanover has done such a wonderful job with in our area is community wellness programs, outreach, home visits, getting involved in the community in different ways. And I think that was also one of the big concerns when this exploration that we have undergone in the last 9 months was embarked upon. And that's something that's very important to me, especially with the mental health issues in the community, the opioid issues, the other substance abuse kind of issues, because it's all intertwined with, our social service system. And and everyone seems to be working together at a very personal level. And there is a concern that, that if it's institutionalized or not being brought down to the community level, that it's not going to be effective. And so I guess my question is, how are you expecting to address those concerns?
Sure, thanks. A couple of ways. One, what's going well will keep going well. We don't plan to come in and change that. You should know that's a focus of ours at the system as it now is. One of the people I see on the screen is a fellow by the name of Mcgregor. Rocky is a senior executive in our company who's in the community engagement group of our company. And so they are measured by how well we personalize care and deal with people. You should know, for example, and the other thing I'd mention, senior executives, CEO, EVPs, everybody, we are required to round in our facilities and find out firsthand how it's going. So, and I've been with Carl when he's asked somebody, well, when did you come? How's it going? How's the food? Is it hot? Is it cold? How are we treating you? And then if those answers aren't what we think, let's just say people know about it. And that's our job. So I want you to know that's a focus of ours now and in all of our areas. And not only will we not change it, our business model is community healthcare. That is what we are. We are a community healthcare system. That is that. And so I've gone a long way to get to this very fundamental point. And that is, in our view, the things that, we're not coming to New Hanover County because it's a fixer-upper. We're here because we think together there are synergies that can expand the great things you're already doing. So don't look for that to change or stop. Look for it to expand and be even bigger.
And if I can, I'll just add to that part of that is to maintain local control. Even for my facility, we have our own board of directors today, and I don't look to Winston or Charlotte for guidance. And Frank and Carl, take my lead on what we need for Brunswick County, which will happen with John and his team to sort of set the strategy. We go to them for resources like an attorney to get us agreement, or go to them when we need higher dollar capital needs. But all of those partnerships that you talk about in the community, we've been doing in Brunswick County, and we lead that locally, and that's what will happen, and we'll continue to grow strong with this partnership as well.
Thank you.
All right, Natalie or Megan, if you guys want to just kind of maybe take over, since I think you can see who's raising their hand and ask questions, I'll let you guys just kind of lead us through the rest of the Q&A.
Super. Well, I don't see any hands raised right now, but there is a question in the chat, Frank and Shelburne. How will the new upcoming Medicaid reform affect the economics in this collaboration and services that we'll be able to provide to all people? Will there be an opportunity to educate the community about this upcoming change and how it will enhance the care of the community?
Oh boy. I thought this early in the morning, a question that tough. Okay, let's see. The straight answer is I don't know exactly how Medicaid reform is going to affect any of us. But if the question is whether that would somehow diminish our enthusiasm for this or make it harder to make this go, the answer to that's no, because it'll affect all of healthcare the same way. We'll still have to take care of the patient. We'll still have to figure it out. Figure out how to make it work. I think the future of healthcare, and the feds are trying. Everybody's trying to figure out how we pay for this as it grows and grows. And the future of healthcare is, I think, headed to population health. So the broader the group we're taking care of, the more people we can take care of, the better we are at community health and driving costs down. Not by scrimping on things people need, but by getting them the care they need earlier in the process and keeping them healthy. That's going to help us make that work. So I'm not worried about that. We have, I have government relations, as you said. So I'm on it. We know, we see where it's going. We have a view about some of it, just to be clear. But whatever it is, we will figure out how to make that work for the system as it then exists.
So there's a note in the chat from Representative Grange if that is a question about Medicaid transformation, that she might be able to add to what Frank had to say.
And I'm not sure if that's what because the term was Medicare, but a lot of people get Medicare and Medicaid mixed up. But, you know, we did just pass the enabling legislation, or the appropriation for Medicaid transformation in our state. And what that actually is going to do, it should actually streamline care for Medicaid recipients, because it will be become managed care as opposed to fee for service. And I would hope, and Frank and Shelburne may be able to add on to that, that I would hope that that would streamline costs and be better for our hospital systems to have Medicaid running that way. I don't know if they have anything more to add on that.
No, I don't. Thank you for that, though. I think, you know, it's an evolving process, and the good part is everybody, you know, both sides of the aisle, the professional group, everybody recognizes we've got to do something different. And I think, you know, this is an idea that everybody's focused on trying to make it better. So, you know, we're gonna get there, and I'm optimistic that we'll get there sooner rather than later. Thank you.
I think I saw Brandon raise his hand. Brandon Corman.
Yep. Thank you so much, Frank and Shelbourne. Thank you so much for taking the time just to eloquently let us know your thoughts. So thanks so much about that. There was a part in your presentation that talked about that you're covering, instead of 200% above the poverty line, 300% now. So obviously that means that there's going to be kind of a gap in revenue. So how do you see, how are you going to kind of make up for that gap?
Well, I'm going to push back on the central premise of your question about a gap in revenue. So we do that, you know, I mean, if by covering the 300 at the 300% level, that will take in more people. But remember, we're talking about, I look at it as an opportunity to get to more people sooner, right? So if I'm taking care of them and I've got them having annual physicals and getting their diabetes checked and keeping their blood pressure down, those things, that's much cheaper than covering fewer people at the 200% level in the acute buildings.
Okay.
So, yeah. So
my apologies. I was thinking that you would use the hospital as the main. So what you're saying is the focus would be the other portions other than the hospital getting to more people, so that potentially that there's a way to get to more people in a preventative measure than having to. Okay.
Wherever you touch us. If you
Gotcha. That makes much more
300%
sense.
or below, you don't get a bill. Yeah.
Okay, so that's a positive thing. So that's great. And then Natalie, there was something within the resolution, but do I just wait to bring that up when we have our discussion later? Is that something I could ask?
Well, if it's a question related to Novant that you saw, then certainly ask that. We're not going to debate the resolution yet.
Exactly. Okay, no, just a quick question that it said there was a certain amount of money in net proceeds. I just wanted to know, how is that fund getting stewarded? So meaning how, you know, there is going to be a large sum of money, and I just wanted to get a sense of how they'd be stewarded to benefit the most amount of people. Is there going to be
so Brandon, that's actually not a question for Novant, because that will be
sorry.
That's okay, no problem. We'll talk about that shortly.
Okay, thank you for answering the first question.
Sure. Mm-hmm.
I don't see anyone with a hand raised, either physically or in the chat box. Oh, there's Lee. Okay, Lee.
Hey guys, Frank and Shelburne, thanks for doing this meeting with us. I really appreciate it. I was actually, well, let me tell you, I'm a financial advisor, and I have a few clients that are hospital employees, and I was lucky enough to go to a retirement party this Friday. And of course, the talk of the town basically is the hospital, this partnership. And at this kind of round table that I was at, a lot of the talk was employees are kind of concerned with if there's going to be any kind of retirement benefit affected, especially the 403B and the pension. I know New Hanover is our largest employer, one of our largest employers in the county, and one of the largest patients that they see are employees. So the employees are wondering how this might affect their retirements and how they'll proceed living in New Hanover, whether it's going to, you know, keep up with all the outside investments moving in, or, you know, can you speak to that at all?
Okay, so I think I heard two questions. First, on the retirement, that's
Okay.
easy. It won't change. The letter of intent that all the lawyers, including me, reviewed and carried over to the definitive agreement as defined by the PAG and the county says that that there'll be no changes to the retirement benefits that the current employees have. And so part of the proceeds will be there to guarantee that those funds remain as needed. Now, the second part of your question, let's see. I'm sorry, would you restate it? Because I'm not, as I think about it, I thought I had it, but I'm not sure I did. Would you restate the second part of your question?
That was kind of it. I mean, if
Okay.
the retirement benefit would be affected, and the 403B, if it would be changed in any way. And they were also kind of wondering if Novant is concentrated on expansion versus like reinvestment. Because, you know, New Hanover has been here for quite some time, and they were wondering if Novant would, you know, capital reinvestment into the hospital itself, or concentrate mainly on expanding and growing in the community.
Okay, now, so you know we've committed to $5 billion over a period of time. So and billion and a half of that is the acquisition price, and the balance of that is a range of investments from foundation to capital to other things. So the answer is yes. We're hopeful that community members would think that that's a substantial commitment to this community in that way.
Okay, thank you.
Sure. Mm-hmm.
Frank and Shelburne, we have a couple questions in the chat. First is, what type of job security stability will Novant Healthcare provide current employees? And I want to just call out that question is from Sean Bynum, who is with Step Up Wilmington, an organization that helps us to get folks ready for employment in our community, and helps them to get jobs when they may be struggling to do that. So, a great organization, and Sean's a great guy.
So we've committed to making, let's see, I want to get it exactly right. I know this is something that's a concern. I want to say this as clearly as I can. We've committed to making no changes to the employment of people who are currently employed and in good standing as of the day of closing, save for cause. And that determination for cause would be determined by the local board and the local leadership. So if you ask where we are on that, we've committed that two things: one, that the local governance will continue, and that we don't have, and that we don't do this anyway, but we don't have any plan to come in and move people out and put new folks in. And keep in mind, again, we aren't interested in this transaction because we see it as my wife's a real estate agent, so I said as a tear down where you go back and build it up. This is, move-in ready, a business that is very successful already, and that we can leverage our joint resources to grow it. So we actually anticipate that there will likely be more jobs than the ones that are here, because as we begin to do more and more things, there'll be additional opportunities. And by the way, one of the things that, one of our philosophies, and particularly mine in the HR group, is that one way to measure how good a company is how many opportunities are there for current people to move up. So we'll be looking for ways to say, okay, here's someone who's done a lot of great things, and maybe they can try something new. We just did that with someone in a group I won't call their name, but who'd been there a long time, and so got new leadership there, and this person raised their hand, so I think I can do it. We say, hey, go try it. And, great, we got a promotion there. Now an officer of the company, you think that's really, that's a good day. So we'll be looking for those opportunities. So I would say, as you're talking to people in the community about this particular subject, understand these things. We want to expand what's here, which should mean opportunity. We want to give people who are here, who have been working and loyal and doing a good job and showing themselves to be, to have the ability to take on more, hey, that'd be great to have them grow. And we're hopeful that, you know, if this thing goes even partially as well as we anticipate, that there'll be many opportunities, both for new employees as we do new things and expand, but also the people who are there to continue to have great careers at New Hanover Regional.
Frank and Shelburne, and this question is a follow-up, I think, to an earlier question. If Medicaid or Medicare is going to be managed care, does that mean people will not have the opportunity to go outside the network with providers who can provide their needs?
Well, I think the short answer on that's no. You know, but think about it like this: you know, if you're if you're covered by any insurance, you know, then, you know, if whoever's in your network that's going to be the best cost proposition for you going to that group. If you go outside that, then, you know, it may be a different set of pricing. But so that's my answer to that. I mean, I don't know that there won't be any legal prohibition against someone being able to choose a physician other than someone who's in the either the new Hanover system as it currently exists or the new combined system should we do this.
Great. Health equity. How does Novant ensure that health equity is kept at the center of appropriate initiatives, including data analytics, disparity identification, diversity inclusion, corporate sponsorships, marketing campaigns, and patient care?
We have an executive vice president whose job it is to worry about that. Number two, it's part of our core values. And maybe since this is a business group, understand that our incentive program, our incentive plan, mine and others, has as a feature of that how well we're doing in health equity goals. And the parent board manages that and asks us tough questions, and we have independent measures of how we're doing. So in sum, we have, you know, we're operationally aligned around it. We're focused on it, and it affects our money if we don't get it.
Frank, I'll just add, all of us look at it every day. There is so much data and analytics that we have at Novant Health. It drives how we decide where we're providing care, what the gaps are, and then it pushes us towards discussions of how do we close those gaps. And it is a discussion that happens every day across Novant Health, and that's the advantage of being part of a large healthcare system. I can call my peers and say, how did you improve on this? Tell me what you did, and we share ideas, and we're going to learn from each other here in Southeast and really being combined partners. How do we close those gaps for all of Southeast North Carolina, working together with community partners?
And that, I just want to highlight that question came from one of the co-chairs of our African American Business Council at the Wilmington Chamber, who is also the Director of Health Equity for New Hanover Regional Medical Center. So it matters deeply to him how that will happen. Next, we have our UNC system school here, UNC Wilmington. Mark Lanier, who's in the Chancellor's office, would like to make a comment. Mark?
Thank you, Natalie, and thank you both for a great presentation this morning, and everyone for their good questions. I just wanted to chime in because I have a conflict at 9 and say that UNCW remains very committed to being a community partner in health. Our College of Health and Human Services has a strong emphasis on community health, on health equity, and I think it would be a good partnership there. And I will not speak for UNCW in saying this, especially with the chairman of my board of trustees online and another trustee online. But I will say that individually, I certainly stand supportive of the resolution. And with that, with the apologies, need to leave for a 9 o'clock meeting.
Thank you, Mark. And to follow on your brief introduction, we do have the chairman of the UNC Wilmington Board of Trustees on the call, Hal Kitchen, who is a lawyer in town. He also is a past chairman of the Chamber Board. Hal, is there anything you'd like to add or ask?
Natalie, I think the conversation we've had so far has been very comprehensive. I just would say good morning to everybody, including Frank and Shelburne, and thank you for being with us today.
Thank you so much for having us. And before you go, Mark, you know, we met, oh gosh, 2 or 3 weeks ago, I guess, with your chancellor and your provost. And maybe you were on, I'm trying to remember, we've had a number of meetings on Zoom, but to talk about that and the fact that in what you're doing, particularly in your College of Health Sciences. So very excited about that possibility and what might happen. And as you know, with the UNC School of Medicine and UNC Health System are part of our, we've collaborated with them to go forward with this proposed partnership. So, look, anything that enhances the breadth of the knowledge and the depth of the knowledge that we can bring to this, it seems to me is an up. And so UNC Wilmington being, the school that it is, it can only be an advantage for what we're trying to do here. So thank you for that support.
Any other questions? We've only got a couple minutes before we really need to transition, so you guys can use the last 15 minutes to discuss the resolution. Michelle, I don't see any.
All right. Well, with that, I would like to once again thank Frank and Shelburne for joining us today. We are just so honored that with all that you guys have on your platter, your incredibly important roles that you hold, that you would take the time to give us an hour today to be able to share your information, to answer the questions that we have. I, for one of the things I try to do as I engage with somebody and make that first impression is as I listen to them, try to get a sense for genuineness. And the two of you gave such genuine answers, such open answers, that I think it just is an example of the culture, Frank, that you described that is part of Novant. And I can personally start to get that initial sense of what I think will be a tremendous partnership. Hopefully things continue to progress as positively as they have so far with our negotiations, and look forward to hopefully getting to know you better in the future.
Well, thank you so much. On behalf of our team, thank all of you for allowing us to be here. It's an honor to do it. An important project, and what I hope is that when the history of this is written, folks will say, those business leaders, all of us, were very wise, and that we did the right thing and we made it work, and that healthcare is better as a result. So thanks so much. Well, I know you all have more business to do, so we will drop off. Thank you. We have an email address, bettertogether@novanthealth.org. Bettertogether@novanthealth.org. So if you have further questions, you send them to us there, and we will get back to you. Thanks.
Fabulous. Thank you, Frank. Thank you, Shelburne. Bye, Courtney.
Thank you, Courtney.
Thanks all. All right, bye.
All right. Now